Hello everyone, welcome to HW News. This is the fourth day of the third lockdown that has been imposed in India. However, the lockdown has been imposed with considerable relaxation from the central government. With some relaxation, more shops have been opening up in this third lockdown. Now, we at HW News have started this special video series throughout the lockdown period to summarize the entire day's coronavirus updates in brief for you. So let us first begin with the global coronavirus cases and the death toll. Globally, coronavirus cases have reached up to 38,44,774 and 2,65,852 people have died due to coronavirus. In India, as of now, there are a total of 52,952 active cases of coronavirus. That means the 50,000 mark has been breached. 15,267 people, on the other hand, have been cured, discharged or migrated, and 1,783 people have died due to coronavirus. From today onwards, however, clinical trials of Ayurvedic medicines like Ashwagandha, Yashti Madhu, Pipli and Ayush 64 are being conducted on health workers and people who are working as frontline warriors in high-risk areas. Union Health Minister Harshvardhan gave this information to media on Thursday. So far, many corona warriors working in hospitals and high-risk areas are being given the hydroxychloroquine tablets. However, the Ayurvedic medicines will now be tried upon them. Now, let's move on to important news related to coronavirus today. The first news is related to the coronavirus curve and when the peak could happen according to the AIIMS Dean. The director of All India Institute of Medical Sciences, Dr. Randeep Guleria, has said that despite imposing the nationwide lockdown for more than 40 days now, India has not seen a declining trend in the new coronavirus cases till now, which is a very serious claim made by the director of AIIMS. Now, speaking in an interview about the need to continue the imposed lockdown and other aggressive measures in red zones, hotspot and adjacent areas, Dr. Guleria explained how countries like Italy and China followed the strict social distancing rules and started getting results within the period of 1 month. However, the same cannot be said about India. To the surprise of many, Dr. Guleria predicted that India is likely to see the peak of COVID-19 in the months of June and July, that is next month and the July month. Observing that the COVID-19 cases are currently increasing at a linear pace in India, he also said that currently the cases are continuing to grow at a flat rate, sometimes even more. So it is very difficult to predict when the peak will come, but it is likely to peak around June or July. Now, this is why we need to be prepared for it and more vigilant to bring the numbers of cases down. He also said that we will need to continue the lockdown for some more time with careful deliberation, considering the health, economy and everything in mind. Well, Dr. Guleria also stressed that one of the reasons behind the increasing COVID-19 cases is also increased testing. Now, his statement came just days after Love Agrawal, the Joint Secretary of Health Ministry, said that considerably India has flattened the COVID-19 curve. Let's move on to second important news. A day after the Karnataka government's decision to scrap trains ferrying migrants back to their home states attracted criticism from several quarters, the B.S. Yediyurappa-led government on Thursday decided to restart the train services for workers. The state government has returned to nodal officers of various states seeking their consent to operate trains to their states from May 8th to May 15th. Now, all these 10 trains that were expected to ferry migrants back to their hometowns this week were cancelled by the Karnataka government, a move which was dubbed by the opposition Congress as holding the workers as hostage. They even claimed that this treatment is at par of bondage labor. Chief Minister B.S. Yediyurappa said he has appealed to migrants to stay as construction work has resumed in the state. The BJP-led government made this decision at a time when around 53,000 people had registered for travelling back to Bihar alone. B.S. Yediyurappa government said that workers are needed for construction activities that have reopened in the state after a meeting with the builder lobby. However, this move attracted a lot of criticism from opposition parties. Let's move on to third important news. At least 42 migrant workers died in road accidents while attempting to return to their hometowns during the coronavirus lockdown. And this is what a released report has said by the Save Life Foundation. The report details road crashes that took place since the lockdown was announced on March 24 till May 3rd. A total of 140 people died in road accidents across India during this period, and 30% of these deaths were of migrant workers who were walking or trying to reach their home states by hiding in buses and trucks. The report says 8 of the migrant workers died after being hit by trucks and speeding cars. The report also says as many as 600 road accidents were recorded across the country during the 2 phases of lockdown. Now, apart from these 42 migrant workers, 17 essential workers also died in road accidents. Of the 40 fatalities, over 100 were reported from 9 states of Delhi, Maharashtra, Gujarat, Assam, Kerala, Karnataka, Rajasthan, Punjab and Tamil Nadu. Punjab has reported the maximum number of people dying in road accident during the entire period of lockdown, followed by the state of Kerala, Delhi and Karnataka. Let's move on to next news. Now you all are aware that since Gujarat's COVID-19 cases are continuously increasing, the entire teams of bureaucrats has been replaced. The newly appointed team of bureaucrats took charge of Gujarat's Ahmedabad, which was placed under a complete lockdown from midnight as an emergency measure to control the spiraling cases of coronavirus. 5 additional companies of paramilitary forces arrived in the city, where only milk and medicine shops will open for a week to rigorously enforce social distancing rules. From Saturday, a similar lockdown will be enforced in Surat as well, where more than 750 cases have been reported. Now, let me remind you that Surat has also seen maximum number of protests from the migrant laborers who were staging the protest across the city, demanding a safe passage to return to their hometowns. Till last evening, Ahmedabad reported 4,425 COVID-19 cases, a chunk of the state's 6,625 cases. With 273 people dying, the mortality rate is 6.1%, which is almost the double of the national average of around 3.3%. After Maharashtra, Gujarat has the highest number of coronavirus cases in the country. Now, whether this complete lockdown in Ahmedabad and Surat will prove to be useful to bring down the COVID cases in the state or not, that we have to look at. For today, that's all for COVID-19 updates. For more news and updates, you can log on to www.hwnews.in.
हमारे घरों में भी बच्चे होते हैं जो हमसे प्यार दुलार की आस करते हैं।
हमारा भी जीवन साथी है जिसको हमारे ड्यूटी से घर आने का इंतजार होता है।
हमारे घर में भी एक बूढ़ी माँ है जिनके लिए आज भी हम ही आंखों के तारे हैं।
लेकिन हम हमारे घरों में नहीं हैं। आपकी सुरक्षा में कोई कसर न रहे, इसलिए हम अपने प्रियजनों से दूर हैं।
हम में से ही कुछ तो अब इतने दूर जा चुके हैं कि वो वापस अपने घरों को लौट भी नहीं पाएंगे।
हमें गर्व है कि हमारे कंधों पे मुंबई शहर के नागरिकों की सुरक्षा की जिम्मेदारी है। हमारे जज्बे और बलिदान को व्यर्थ न जाने दे। इस संकट के समय में आप घर पे रहे, सुरक्षित रहे।
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.
If you like this video, please share it, and we would love to hear your comments in the comments section down here. Also, please do like our Facebook page and follow us on Twitter to get minute-to-minute news updates. For more such shows and videos, well, subscribe to our YouTube channel.